I'm Declan O'Farrell. I'm Chairman of the Hertfordshire Community Trust. I take ultimate responsibility for the performance of the board. The Trust is a very diverse organisation, over 3,000 staff. We serve the community in Hertfordshire and in West Essex. It's very diverse, so unlike a hospital where they might employ 3,500 people and they all go to basically the same place, our 3,000 people are spread all over. We've got 70, 80 different sites that we work from. So that diversity and geographic spread is an issue that needs constant management. Well, the board is a relatively new board. The Trust itself only started in October 2010. So yeah, from the start, it was absolutely mandatory really. You can't start a new organisation without bringing everybody together and saying, look, we're not a team, but we want to be, and take it from there. We have, anyway, the annual appraisals, and I had been familiar with the 360 approach in other positions that I've held. So I was familiar with the concept, and I knew it could be powerful, especially if we could get a true 360 appreciation. And it would offer us all an opportunity to inform upwards and receive from below and from peers at either side how people think we're getting on and what they think we're good at, what they think we need to work on. I think the group feedback session was the key session for the board. I mean, we all went through the 360 individually. What it did, it helped us to take a more helicopter view about what it was doing. Part of the process was to allow people to say what they felt about certain things, because lo and behold, they weren't alone. And all of a sudden, what were individual problems became group problems, became team problems, because we all realise if everybody's not hammering away, hammer and tongs 100% on what they're doing because they're worried about stuff, then you're not getting the best results. But we decided that as part of this process, what we really needed to do was to put capacity down into the localities, because we saw the future of community services being locality based, so working with social care, the GPs and our own services, mental health. If we could create more leadership and drive and management at locality level, the theory was then, well, less would have to be directed from the centre, and that would offer more capacity to the higher levels, who could then look more at strategic issues. One of our values is continuous learning. So we will go anywhere really to investigate stuff if we think it will help us reflect and learn and listen to others. So at the time we got up and we left the room after the day, tired and all the rest of it, and we came away with 2 or 3 or 4 things we thought, well, yeah, we must try that. But when we brought it back into the workplace, we found it was just a leverage. We've got less meetings, we've got less items in less meetings, and we've got shorter reports on less items in less meetings, yeah? We haven't lost anything as a result. So what we're trying to do is divert that time and attention to the things we think are more important. We set up a WhatsApp group just for the board. It's a relationship thing which brings out the humanity, which often gets lost, I think, when you're just trying to do stuff for everybody else. And we saw the 360 process as being additive to what we're trying to do. So if there are other people in other organisations who believe in continuous improvement, they really ought to seriously look at this product, because it will help them achieve. Maybe they're doing it as part of their appraisal process, but they really ought to try and do it as a whole board, try and get that helicopter view about what they're saying about themselves and what others are saying about them, because that adds a new dimension, and that's worth having.